Welcome to Pharmacy Technology and Management Review's Direct Access podcast. I'm Maggie Lockwood, and today we're going to be talking about bridging the gap, how technology is empowering pharmacists to transform patient care. My guests are Megan Wagnon, who's Director of Product at Clarest Health, and Erin Mattingly, VP of Marketing. In our conversation, we're looking at how Clarest is empowering pharmacists to play a more integral role in patient care. Recognizing that pharmacists are the true medication experts, Clarest is developing innovative technology solutions to streamline workflows, improve communication, and ultimately enhance patient well-being. Some of the key offerings we're talking about are MTM Path, a platform designed to streamline medication therapy management, CarePack, which is a patient-specific packaging solution to improve adherence, and CareFillRx, a program that ties everything together to create a holistic program that supports patients throughout their healthcare journey, ensuring they never fall through the cracks. It's really about empowering pharmacists to make a real difference in patients' lives. I hope you enjoy the program. The topic today is empowering pharmacists to bridge the care gap, which I think is a pretty familiar topic for pharmacy at this point, an important topic for pharmacy at this point, that pharmacists are in the perfect position to provide professional expertise in this current healthcare landscape. And we thought you would be a good person to talk to, Megan, and tell us more about this and what's happening with Clarest. And then Erin, I didn't know if you wanted to add anything or set the stage for us as well.
Clarest is committed to making medication management across the post-acute care continuum consistent. There is a ongoing challenge between coordination between providers and consistency in the medication management. So oftentimes we have that primary care provider, as we've said before, that is that center point for a patient or a resident, and all of the pieces and parts of their healthcare kind of come together at that point. But for medication management and pharmacy in general, there's not that streamlined, cohesive treatment plan. And so our goal is to create that, because pharmacists are truly the kind of best educated experts in medication. All physicians know about medication, but they don't know the in-depth side of it. They don't study it like pharmacists do. And so when you have a patient who is on multiple medications from multiple different specialists and has been in multiple different facilities that may have changed medications while they were admitted, and now they still have the prescriptions outside of that, they go, okay, well, Dr. Smith prescribed me this and Dr. Jones prescribed me this. There's nobody to say there's an interaction, or something is not going to be as effective if you take, those two medications together. And so our goal is to really look at that entire patient journey and say, where do we need to create that cohesive line and insert that medication expertise? And how do we do it with technology that makes it easier across the board as we look at transitions in care and care settings and where the patient is in their medical journey?
I think the one of the key points you make is streamline. Because there are some settings and then different care providers. So, and the pharmacists do have that overall umbrella, ability to look at everything like covering that patient.
Right. And traditionally that was covered by a retail pharmacist, right? Even 10 years ago, my parents would go to their pharmacist who would offer that level of expertise. But now we're in a different realm where the retail pharmacies have just gotten so big. Mm-hmm. And the retail pharmacists simply don't have the time to go as in-depth or as far as they maybe would like to, just because of the restrictions on the amount of time they have to serve every patient.
Right.
If you look at a personal medical journey, even I, who am not a complex patient, not elderly, I could spend hours on the phone between my pharmacy, my insurance, my pharmacy insurance, my different, specialties, trying to coordinate all of that care. It's overwhelming. And it is something that when you get to a point as a patient and you've touched all these bases and you spent this time on the phone and you're frustrated, it's easy to give up.
Yeah.
But medication really serves such a huge role in becoming well and being the best that you can be, no matter what your condition is. And if we don't address that critical piece to health, um, you know, there are pieces that are missing, and that patient might not receive the optimal outcome that we all see that they could have. And so that's where this comes in, is kind of that, like, let's handhold and give them the resource to make this easier to achieve their medical goals or health goals with the use of medication and utilize that pharmacy expertise that we have.
I think it's a good place then to segue into Megan. Do you want to share your experience and sort of your background in this area?
Yeah, so I'm the director of product here at Clarest, and I'm also a pharmacist by education, and I have hospital and retail experience. And I can definitely say that note on being a retail pharmacist. It used to be that you knew your neighborhood pharmacist and they could review your meds, and the climate has shifted where that bandwidth is significantly less. And then I can also say from like a hospital setting where sometimes patients will go home on meds that they're only supposed to take for a short period of time. They kind of keep taking them, or they don't understand, or they take them incorrectly. And that's something that isn't always caught in a retail setting. There might be a med they were only supposed to be on for a couple of months, and it just keeps getting filled. Or just gaps in communication on that patient's health literacy. I think it's hard. The medical system is hard. There's a reason several people within the system spend several years trying to get educated in those specialized areas, and expecting a patient to understand all of that is obviously a huge burden and not realistic. So that's why we have these specialties. That's why that pharmacist role, in order to educate the patient and help with adherence gaps to prevent those medication errors, especially when you're transitioning from a long-term care facility to home. That's a huge gap that we find where medications are obviously handled differently in those settings. And that gap of that transition is something that needs to be addressed. And with Clarest, we're really trying to approach the patient as a whole thing and follow them throughout the continuation of their journey and really address those adherence gaps, those med errors, and just provide the patient with the education that they need in order to be successful and remain healthy. You know, that's the end goal, is better patient care across the board through the entire patient's life.
Right. And I think the education piece you're talking about, especially as that example you just gave, where you go from a setting where there's a professional administering the medication to going home, right? That's a very clear place where so many things can get dropped. That's really where the pharmacist can shine, right?
Absolutely.
Because pull those three pieces together. That's sort of a pharmacist bread and butter, like you were talking about. You know, they're so busy, the situation has changed for them. And I think that's where we can talk about these digital tools, workflows. Maybe you could share a little bit about that. The different tools that you see are key to being able to do that.
Yeah, I think that, you know, leveraging EHRs and having that ability to be able to see in like a long-term care setting, here's the notes that these providers are writing, having that kind of pharmacist interaction with that, you know, and more of a payer MTM space, having that exposure into what those payer kind of claims are and the data and diagnoses information, that paints the whole picture. And it kind of goes back to that specialty idea. Your cardiologist might be, you know, prescribing a certain medication that your PCP might not know about until, you know, 6 months later when you have a visit, or the patient might not have conveyed all of their meds accurately to that cardiologist. And so using that kind of breakdown between those groups and having those outreaches to those patients, and just using technology and communication with the patient to streamline those types of barriers with those patient and improve the patient care is really the goal. You can, once again, it goes back to those adherence and those errors and those conversations with that patient.
Can you give us a couple examples? Like, what do you feel if you were to do like a case study example using specific Clarest tools or software? What
what would you see as being sort of the ideal journey with
Yeah.
almost for the pharmacist, right? For the pharmacist supporting the patient through the patient journey, if that makes sense.
Yeah, exactly. So, we have a product within the Clarest umbrella that's called MTM Path. And that's used a lot in the payer space, but can also be used in that long-term care space, and other areas, transitions of care as well, that really allows a pharmacist to review those diagnoses information, review the medications the patient's on holistically from all different outlets that are prescribing them. And then that paints that entire comprehensive picture regarding the patient so that the clinician can see, regardless of where they're filling these meds, regardless of who they're seeing, we can manage those care gaps and those adherence issues with that patient. We can say, why aren't you taking this medication, and educate them that that's just a potential side effect and switch them to a different drug. Or we could switch them to a different drug that's a cost savings for the patient. So leveraging our internal tools in order to really see the patient picture as a whole and use our technology to see that whole picture, really takes some burden off the patient, in a really complex environment, and allow us to address that patient care.
Well, and also makes it easy for the pharmacist to do it, right? I mean, I would say normally you'd have to run a report or have,
Exactly.
a tech or somebody in the pharmacy create this information for you to review, for then to communicate. I would assume the communication tools are a big part of this tool, to be able to not only communicate with the patient, but also with the other caregivers in.
That's exactly right. What we're able to do is really reduce steps and the burden on the pharmacist, being the clinician in that situation, having to rack their brain for all of the current guidelines. Not saying that they can't, but this tool of MT Empath really allows to streamline that process. Here's the current guidelines. Here's what the patient is a candidate for based on their medications, based on their diagnoses. They should be on this class of medication, or here's a warning on these drug interactions that you might not recall from school, or might be something that you're unfamiliar with, or a specialty drug that you might not know that interaction. So it really remove some of that burden for some of those items for the clinician to just reduce those errors and be able to catch the things that might not have been filled, or like when they were being filled, I guess. If that makes sense.
Right.
And one of the things that we do is, after those interactions with the patients and that holistic look at the patient and their medication management, we're able to produce a recommendation plan that is then communicated both with the patient, any providers, any kind of pharmacist. And so again, to Megan's point, it kind of takes the guesswork out for those providers within that patient's care network, and offers that expertise to say, okay, here's the guidance on how to best manage their medication. We have adherence tools, we have all sorts of things that help to boost that, so that everybody surrounding that patient is educated on what that looks like.
Yeah, and just to piggyback off of that, I think that's a great call out, that we're generating this information for the provider, but in a retail setting, that's okay, now I have to call the provider. I need to say, here's this medication. They shouldn't be taking it. Here's this drug-drug interaction. I'm playing phone tag with that provider, trying to explain to them in the 2 minutes between appointments, if I happen to get them, here's the reason that this should change. There isn't a automated process in the retail setting to call out those types of issues. It's all manual. And with something like MT Empath and how we leverage that tool, it is automated. It shows, here's the guideline, why it's saying that. Here's the reasons, those drug-drug interactions, or the documentation behind that. And that's all automated. The pharmacist doesn't have to do it. It comes up, the pharmacist decides that's the recommendation I need to provide to this provider, and I'll let the patient know as well so they can address it with their provider. And it's automated. So that really is not something that exists in a retail setting that we're able to accomplish with MT Empath.
Right. And again, like you're saying, long-term care, this is sort of standard, right? They're used to having somebody on the other side in the facility to communicate with. This broadens that communication. And then for for retail setting with the concept of medical at home, long-term care at home, this is going to be more common.
We have our offering of Care Pack that allows us to do that specific patient packaging, which not only reduces that burden of knowledge for the patient, but we're also monthly assessing that patient and making sure that their meds are up to date, making sure that they are adherent. You know, if they're not taking one of the pills in their package, we can address that with them. It really increases the adherence for the patient because we keep that streamlined communication in and really try to improve their care and have a constant beat on it, which unlike specialty providers or even your PCP, you see them once a year to get your meds renewed. You see your specialists maybe every 6 months, maybe every 3 months if you're a really severe case. And so these types of outreaches of and additional outreaches to the existing care that the patient has lined up really is what makes the difference in those mainstream pharmacy interactions with the patient are what allows us to bridge those gaps by using MTM Path, our technology, the Care Pack, the actual packaging of it. Both of those really play hand in hand.
Yes.
And I think that applies.
Go ahead.
Sorry, I think that applies across the patient journey, right? So MTM Path can be used as a tool for consulting pharmacists within an LTC setting. Again, it it follows then the patient through whatever settings they're in. And in a typical MTM format that CMS has mandated through the years, the comprehensive medication assessment is done, and then the care plan is made, and it kind of goes off. Like we communicated or it's communicated and then it goes away. For us, that's just a continuation of the journey. So as they continue to transition in care and end up in that long-term care at home type of format, we can also follow them home with CareFell RX, which to Megan's point, that allows us to manage the adherence side of it, because just doing the side and the technology and making sure that we follow them and have a good record of their entire medication management and prescription and health challenges is one side of it. But then really, I think everything leads back to adherence, right? So we can do all of those things. And if a patient is not adherent, it affects the pharmacist, it affects the provider, and most importantly, it affects the patient. And so by us offering that extra level of CareFell where they receive their medications at home and it's in that compliance packaging when they receive it, and we have the follow-up and we have the education and the adherence tools that are provided to the patient, we now then have created this holistic program where they're never forgotten, right? We never let them fall off of our radar because we are following them from point A to point D.
Tell me more about CareFell RX, because
we have a couple different versions of compliance packaging. One being compliance packaging in an LTC environment. That is our Care Pack product and is very much what Megan was talking about, in that when a patient is in an LTC environment, their medications are changing, med pass can be difficult. There's a pharmacist who's coming in and doing, these regular visits, but they're not distributing the meds every day. And so our first course of action there to solve this problem is, how can we package this medication to make it easier, faster, better for the nurse who is administering those medications within that LTC environment? How do we send them home with that packaging to make sure that they are remaining compliant and adherent? And then making sure that after that LTC visit and that after that pharmacy that's within that, or the pharmacist that's within that LTC environment managing the patient's meds, through the transition, we're doing MTM follow-up through MTM Path, and we are sending the patient home with the right meds, and then we're reassessing that, and we're giving them a full care plan and taking on CareFell RX, which is our medication at home. And that includes an initial visit with a pharmacy expert who will go back and look at everything that was done throughout the time that you've been there and assess the medications. They take into account anything that's going on within the house. So any kind of conditions, adherence barriers, that kind of thing. They see all of that and they incorporate that in that medication management plan. And then the medications are delivered in that compliance packaging to make it easy. They're labeled date and time with the contents. So Tuesday at 10 a.m., here's the meds that you take. And patient can just open them up and take their meds. That allows us to really track that adherence because at the end of the day, as I said, all roads lead back to adherence, right? We can do all of these great things. We can coordinate all of this. We can make it a holistic view. But if the patient at the end of all of this, in their time that they are at home being cared for, are not adhering to their medications, it's still not going to work, right? So we wanted to pick it apart and really make sure that we hit every touch point with a patient and their medication and their pharmacist to make sure that we did everything within our power to cover all of those bases.
What's interesting to me is the fact you have someone coming out initially to make sure everyone is pharmacist, patient, caregiver, all on the same page.
We offer both virtual and in person. So it depends on the region and the area, of course, but we have both of those options so that after that transition of care and the patient has time to settle in with their caregiver, whoever that may be, we're able to go in and in person do that assessment, either virtual do that assessment, and then be their fulfillment pharmacy again, so we can track that adherence and those kinds of pieces that may impact the patient's outcomes. And MT Empath is kind of the driver of all of this as we look at the continuum of care.
I think you touched upon this earlier. Maybe you see your primary care provider once a year, or you might see a specialist twice a year, and that puts a lot of expectations on a patient, on a person to take care of themselves. And like you're talking about with complex patient medication plans, that can be difficult. And so I think it's just such an opportunity for pharmacists to have all this presented.
And Maggie, that's actually an excellent segue to, Megan is an expert on how MT Empath works, obviously. And so you just mentioned the very complex patients, the ones with chronic illnesses, complex medication regimens that can often get kind of muddy throughout this entire process. And I think that I want to have Megan speak on the different clinical programs that MT Empath has built into it. So we go so far beyond that traditional medication therapy management, or MTM as it's defined, because that is one piece of a larger picture of what we do. And when I was trying to explain this to a friend, I said, okay, imagine that you didn't have to go to 3 different places to access a pharmacist who is an expert in cardiology, the current practices within cardiology, the current medications and new and upcoming effects, all of those things. So imagine you had all of these top level experts in one place giving the information to better plan for this patient. All of that is built into MT Empath in specialty programs. And so I'll let Megan talk a little bit further about how that's done, but that really speaks to how we're looking at the future and moving forward. So we currently have all these programs, but this is really, we believe, the future of how, pharmacists are going to work in having these tools that give them a boost of expertise.
Yeah, Megan, share.
Yes.
Give us the deep dive on this.
I love it. Perfect. Sounds good. Yeah. So we have a lot of different offerings that we provide at MT Empath. For example, we have a pretty comprehensive adherence offering that allows us to calculate how adherent a patient is based on their fills over periods of time. So that allows us to see, are they due for a fill in a couple of days and historically haven't been adherent? Let's reach out to them and figure out what those barriers are. Maybe it is as simple as an education that's a side effect let's switch you to a different drug from a different class that benefits this patient. And then we can send that communication to the provider so that the provider can make that change of that medication automatically. So it really allows us to determine what that barrier is prior to it becoming a problem when they go to their PCP visit and they tell their primary care provider, I haven't taken that med in 8 months.
Right,
I didn't like this side effect,
Right.
It's a lot harder to catch it on the back end. And so being more proactive, saying they're coming up on a fill, they haven't filled in 2 weeks. Let's figure out what the issue is there. That's one of many programs we have. We also have ones that are disease state focused. So we have diabetes programs. We have the initiation of statins because that really does reduce a patient's morbidity and mortality long term. And we've seen so much benefit from those. So getting those on board for the patients that qualify is a simple addition, low cost to a patient, and large benefit long term, but is not something that is always caught or could be caught sooner. We have obviously stuff like polypharmacy, patients who are using multiple pharmacies, multiple anticholinergic drugs that is high risk for patients that are not always evaluated. Maybe they're taking some over the counter on top of already over being prescribed. We have opioid-based ones that evaluate the volume, based on their morphine mill equivalents of how many opioids they're taking, and we can be proactive to creating a plan for them with that. We have smoking cessation programs, especially with the rise in vaping and stuff like that, and that kind of being perceived as not really smoking, it still is something to be evaluated. And so screening patients for that, and catching that early on in our assessments can really help long term in that education of saying, I know vaping might not seem like it's the same thing as smoking, a Marlboro Red like the old days, but it's an important factor and intervention that pharmacists can have. Recommending those tools in order to quit smoking is a huge benefit in health. So that's just a few of our programs, but there's several of them to address those disease states, address, cardiovascular or hypertension, how many meds you have on board. Typically more than 2 is what the guidelines say is the most success. So a patient might be on one. Diabetes, and making sure we evaluate when have they had their last vision exam? Have they had foot exams? Are they checking their feet themselves regularly? Just having that conversation with the patient, and kind of breaking down those barriers. And it's amazing what having additional outreach to somebody's home and calling them and talking to them, the difference that you make in that patient's care, more than just, oh, I went to my doctor once a year.
Right. Right. And well, and I would assume a big part of this also is the ability to document everything.
Yes.
In the system, and it's easy to do and easy to pull up the care plan and review it.
Exactly. And that's another component that happens here. We'll go through a set of questions. Let's say we're evaluating your smoking history. Let's say it comes up that you are a vapor and you vape really frequently. We have what we call like kind of triggering recommendations based on that. Let's say they also have hypertension too. Then we can, have a recommendation. Hey, would you like to try Nicorette gum? You can get that over the counter if you go to your local pharmacy. Let's try to do that counseling for smoking cessation. Or also, if it is disease specific, let's say they're not on the optimal treatment for their diabetes meds. Let's say their A1C is high, or there turns out to be a drug interaction with another drug and another one might be more optimal. We can bring that up with the patient, also send something to the provider regarding it, letting the provider know, hey, this isn't optimal therapy. Technically, guidelines recommend this. We suggest stopping this medication and starting this medication instead. So it really is allowing us a simple way as a clinician. Hey, I asked all of these questions. What does that mean? Well, we're instantly using that information to make that recommendation for the patient, and then something to the provider as well to implement change in this patient's care.
Right. And it's all documented in the system. So
Exactly.
you don't reinvent the wheel every time you do this.
No.
Monthly.
Yep, exactly.
And then I would assume this is because the next step also for pharmacists is to be able to submit for payment eventually, hopefully, right? And I know the rules are different in long-term care and long-term care at home than for retail, but when you have all this data and all the patient information, in your system, then you're able to submit it for possible payment depending on the insurance or the care situation.
Yep, there is definitely that ability, and it's something that we have within MTM Path. We have some plans who are utilizing that, trying to bill for that as well. There's also our advanced pharmacy network where your local pharmacy will do these assessments on you as opposed to via a phone call. And that local pharmacy can also submit for payment or reimbursement for those types of interventions as well, which is obviously a huge value add as we try to get pharmacists a bigger seat at the table to say we have a value in this care, and incentivize them to do those types of interactions with the patient.
You know, a hot button topic right now is really medications maybe being denied coverage for whatever reason by some payers. And I think that our technology and system and the way that we run it really assist in making the case. Because at the end of the day, the prescriber is the one who has to fight this battle, right? Hey, I want to put this patient on a statin. Insurance says we don't think they need one. And you have to have clear documentation and evidence that it would in fact benefit the patient. And there is a lot of information and items within MTM Path that can help boost that ability within MTM Path so that the pharmacist or the provider has everything they need to say, hey, here is why you need to approve that medication.
Right. And that has to be, from a patient's point of view, a huge benefit because they don't have the skills to do it.
Mm-hmm.
So it just seems like that really does. Again, we started out the conversation about pharmacists being empowered to be bridging the gap in care, and it kind of goes full circle when you bring that up, because suddenly they're very much in a position with these tools to do that. The technology is there to make the pharmacist very much the center of all this.
Absolutely. Yeah, a way more proactive role as opposed to catching it at the retail setting. We're able to promote it. And a lot of times, especially when you talk about initiating drugs or working off of guidelines as far as here's what your drug regimen should be for a disease state, that is, I think, a really hard thing to accomplish in a retail setting, filling for a patient that is an unrealistic burden based on just how retail is now. To take a guideline and say, you should initiate this medication. I have 300 fills in my queue. I'm going to go call your doctor and try to persuade them to send in a prescription, while you're here or over the next couple of weeks to kind of get that med started. That is a much harder hill for a pharmacist to climb, which is probably what has created a system where a pharmacist doesn't necessarily do that type of interaction with a patient in a retail setting. And so removing it from that retail setting and allowing a platform like MTM Path and that dedicated resource to be able to have that conversation with the patient saying, hey, don't worry about it. Here's something that you should probably talk to your provider about the next time you see them. But in the meantime, I'm sending them a fax as soon as I'm done with this phone call, and they're going to see, hey, I should start this medication for this patient. And I've given them all the reasons why they should start this medication. And then they can it's as simple as them putting in a prescription for it, or maybe an additional follow-up with your provider in a shorter period of time because you've been able to close that gap.
Right.
Everything that we've created is from a pharmacist perspective, right? So Clarest is led by pharmacists. The developers and people like Megan and all of our experts are really pharmacists with pharmacist backgrounds. So when you look at how do these things impact a pharmacist throughout this entire journey, it truly is from a pharmacist perspective. Megan, who's worked in retail in multiple different settings, knows what works for a pharmacist operationally and workflow wise. And so it creates this different perspective on when we're creating these tools, making sure that they work well for pharmacists and providers, anybody who's involved in the process, but really focused on, as a pharmacist, what would I like? What would I do? How would I do this?
That's the overall goal, is for them to feel empowered to be clinicians and not just putting out fires or filling prescriptions, but actually moving patient care forward.
A
Exactly.
true part of the care team.
Yeah,
Mm-hmm.
a great conversation. Is there anything else either of you wanted to add?
No, thank you so much for your time and all of the good questions. I love
No,
talking
this-
about it, so this was great.
Yeah, no, I learned a lot because I am seeing how all the pieces fit together. So it's very helpful to get a better picture about how this works and how powerful it really is.